Which of the following is a test for hip dysplasia in an infant? A. Faber test. B. Thomas test. C. Ortolani test. D. Ober test. The answer is C. Ortolani test. An examiner can look for hip dysplasia in an infant using the Ortolani test. This is performed by placing the child supine, then flexing the hip and knee to 90 degrees. They would then gently abduct the leg while placing downward pressure on the greater trochanter. In a healthy joint, the hip will move freely. In hip dysplasia, there will be a feeling of a clunk as the femoral head is relocated into the acetabulum. The Ober test, Thomas test, and Faber test all check for hip stability and injury in adult populations, rather than pediatric. A new mother is holding her infant just moments after delivery. After she is able to rest for a short time, she looks down and notices that her newborn is covered in fine, but fairly dark hair. This is on the infant's arms, legs, and back. She is startled and asks the nurse if this is a sign of any disorder. How should the nurse reply? A. This is abnormal, a hormone profile is required to rule out hormonal disorder. B. This is normal, it should be shed in a few days. C. This is a sign of a serious metabolic disorder. D. This may be normal, the child should be monitored. The answer is B. This is normal, it should be shed in a few days. Fine, downy hair, called Laneigo, generally appears on the fetus around 5 months of gestation. It is often shed before birth, but some infants are born with this hair still intact. The hair is normally shed within the first 1 to 3 weeks of life. In most cases it is entirely normal and not a sign of hormone or metabolic disorder. A young couple presents to a clinic with a 7-year-old who has varicella, chickenpox. The child is not in any distress and the virus seems to be progressing normally. They are concerned, however, because one of them is currently pregnant with their second child. They are at 31 weeks of gestation. The carrying mother had chickenpox when she was 2 years old. They asked the nurse if they should be concerned for the health of the unborn child. Which of the following is the most appropriate response? A. There is no need for concern. B. Frequent hand washing is recommended to prevent passing of the viral load to the fetus. C. The mother should not be in contact with the 7-year-old till the last lesion is scabbed over. D. There is mild need for concern, fetal monitoring is recommended. The answer is A. There is no need for concern. As long as the carrying mother has had varicella, she will be able to pass the antibodies to the virus through the placenta to the unborn child. This will confer passive immunity to the fetus. This immunity lasts for the first few months after birth, so newborns delivered by mothers with immunity to varicella will remain immune for some time even after delivery. Increased immunity to this and other pathogens is conferred by breast milk, which contains maternal antibodies, mostly Ig. By 5 months of age, what change would be expected in an infant's weight? A. Triple. B. Increase by at least 70%. C. Increase by at least 50%. D. Double. The answer is D. Double. An infant would be expected to double its birth weight by 5 months. Some infants may double their birth weight by 3 to 4 months. An infant that has surpassed 5 months without approaching twice their birth weight may need to be evaluated for feeding difficulties or failure to thrive. At what time does molding, The elongation of the baby's head as it passes through the birth canal, resolve in a newborn? A. Less than 24 hours. B. 2 to 3 weeks. C. 10 to 14 days. D. 1 to 5 days. The answer is D. 1 to 5 days. Molding, or the elongation of the infant's head during labor and delivery, is a normal adaptation allowing the relatively large skull to traverse the narrow space of the birth canal. It generally resolves in 1 to 5 days.